When a patient starts to deteriorate, the body doesn't shut down all at once. Instead, blood flow to organs is reduced in a predictable sequence. First, the skin and gut, then the kidneys and lungs, and finally the brain and heart. Recognizing these stages early can help nurses prevent organ failure. Today we're breaking down the signs of poor perfusion and the medications whose toxicity follows the same pattern. Welcome back to Nurse BrainRx. Perfusion refers to the delivery of oxygenated blood to tissues and organs. When perfusion becomes inadequate, the body tries to protect vital organs. This protective response creates a predictable sequence of organ dysfunction. Let's walk through the stages, starting with the first organs affected. The first organs affected are usually the skin and gastrointestinal tract. These areas receive less blood to preserve circulation to the brain and heart. One of the earliest signs is cool, clammy skin. This occurs because blood vessels in the skin constrict. You may also see pale skin or cyanosis. The gastrointestinal system is also highly sensitive. Signs may include decreased bowel sounds, abdominal discomfort, or nausea. Several medications show early toxicity in the GI tract. Digoxin often causes nausea and vomiting as an early warning sign of toxicity. Another example is metformin, which may cause GI upset if levels accumulate due to poor perfusion. If perfusion continues to worsen, the next organs affected are the kidneys, liver, and lungs. The kidneys are very sensitive to these changes. Signs include reduced urine output or rising creatinine levels. A urine output less than 0.5 milliliters per kilogram per hour indicates impaired perfusion. The liver also depends on adequate blood supply. Poor perfusion may cause elevated liver enzymes or impaired metabolism of medications. As perfusion worsens, patients may develop an increased respiratory rate or decreased oxygen saturation as the body compensates. Some medications show toxicity here too, like gentamicin affecting the kidneys or amiodarone causing lung toxicity. If perfusion continues to decline, the final organs affected are the most vital, the brain and heart. This stage involves life-threatening organ failure. The brain is extremely sensitive to oxygen deprivation. Signs include confusion, restlessness, or an altered level of consciousness. The heart itself may also become ischemic, leading to chest pain, cardiac arrhythmias, or significant ECG changes. Certain medications show severe toxicity here. Lidocaine can cause seizures, while theophylline can lead to severe arrhythmias. When perfusion becomes inadequate, the body sacrifices organs in a predictable order: early skin and GI, intermediate kidneys, liver, and lungs, and late brain and heart. Recognizing these stages allows nurses to identify patient deterioration early. Poor perfusion is a medical emergency. By recognizing subtle changes in skin temperature, urine output, or mental status, you can potentially save a patient's life. Understanding how perfusion affects each system will help you recognize deterioration faster and provide safer patient care. Subscribe to Nurse BrainRx for more clinical lessons that help you think critically and practice like an experienced nurse.